What are shelter medicine protocols for animal shelter managers? Imagine walking into a busy animal shelter and knowing that every animal is receiving the best possible care. That's where shelter medicine protocols come into play. These are detailed rules and procedures that help shelter managers keep animals healthy, safe, and happy. They cover many areas like how animals are brought in, housed, and treated. They also include steps to prevent disease and reduce stress for animals in the shelter. When animals arrive at a shelter, they go through an intake and evaluation process. This means checking their health and behavior to see if they need medical attention or special housing. For example, animals with contagious diseases are separated from healthy ones right away. Proper housing is essential. Shelters must provide clean, safe spaces that suit each species. Dogs and cats need different environments, and animals should be grouped based on their health, age, and temperament. This helps prevent the spread of illness and keeps animals calmer. Shelter managers follow strict disease prevention rules. These include vaccinating animals against common illnesses like rabies and distemper. Parasite control is also important, so animals are regularly treated for fleas and worms. Shelters have quarantine areas for new or sick animals. These spaces are isolated for at least 2 weeks to monitor health and prevent infection spread. Cleaning routines are also vital. Staff clean from the cleanest areas to the most contaminated zones to keep everything sanitary. Stress reduction is another big part of shelter protocols. Animals can get anxious or depressed in a shelter environment. To help, shelters provide toys, hiding spots, and opportunities for exercise and socialization. Some shelters even play calming music or use feeding puzzles to keep animals relaxed. In some cases, temporary medication may be used to ease anxiety. Managing the number of animals in the shelter is also important. This means controlling intake, promoting adoptions, and transferring animals to rescue groups when needed. If the shelter gets too crowded, euthanasia might be considered, but only as a last resort and following strict ethical guidelines. Medical care is ongoing. Shelter staff monitor animals daily, treat illnesses promptly, and keep detailed records. These records include health status, treatments, and behavior notes. This helps staff make good decisions and track progress. When necessary, humane euthanasia is performed with care and compassion. Staff and volunteers are trained regularly. They learn how to handle animals properly, recognize signs of illness, and reduce stress. Proper training ensures everyone knows how to keep animals safe and comfortable. Shelters also work with veterinarians and community groups. They share resources and coordinate efforts to improve animal welfare outside the shelter. This might include foster programs or community cat management. All these protocols are based on current research and best practices. They are updated often to include new knowledge. For shelter managers, understanding and applying these rules creates a safe, healthy environment. It helps animals recover, find new homes, and thrive. It also makes the shelter a better place for staff and volunteers to work. Following shelter medicine protocols is the foundation of good animal shelter management.